Welcome back, everybody. 1 in 8 women here in the U.S. will be diagnosed with breast cancer in their lifetime. That's according to the American Cancer Society. However, when it's discovered and diagnosed early, the survival rate after 5 years of treatment is 99%. It's why every October we recognize Breast Cancer Awareness Month.
And joining us today is Dr. Chrystal Murray, an oncologist with Baylor Scott and White Health. Thank you so much for joining us today.
Thank you for having me.
Let's start at the very beginning. When we talk about detection and early prevention, where should people even begin?
I think one of the best places to start is really understand your risk. We all have different risk factors. There's a number of them, including family history and other medical issues. And so if you understand your risk, you can have a conversation with your physician about what do you need to do for screening purposes and even potentially prevention.
What are some of those questions that you think people should be asking their doctor about that?
With regards to risk, what we need to know is certainly family history and finding out if anybody, immediate family, but also beyond that, a lot of us don't know aunts, uncles, grandparents, what their histories were. And so that's going to be really important.
Start talking to your family members.
Absolutely.
Finding out those things. Okay, let's talk about self-exams because a lot of people may not even know where to start with that. How important are those?
Yeah, self-exam, there's a lot of conflicting data around that, but I think what's most important for women to understand is if they know their breasts and what they feel like, they're going to be able to see when that changes.
Regarding mammograms specifically, guidelines change depending on someone's risk level. So what would you recommend?
There's actually a number of different guidelines and they're slightly different. I think the benefit with that is that there's a lot of flexibility to be able to get what you need for an individual person. And so if they have higher risk, they may be able to get mammograms more frequently or get even some supplemental exams. If they're lower risk, maybe they don't do the exams every year.
So for people who may have recently been diagnosed or they know that they have a family history, they're doing some of these extra exams, what do you tell people about the next steps? What does treatment really look like?
Treatment can look a number of different ways depending upon what an individual's type of cancer is. And so the first thing is to really get your team in place. And I think a great place to start is to start with your primary doctor so that they can refer you to the folks that they really trust and can help guide you.
Of course, we are 5 years past the start of the COVID pandemic really heavily here in the U.S. So when you look back at that, how did that exactly change how you care for patients?
Yeah, so there were obviously a lot of really hard things that happened in medicine in particular. However, I do think that there are some positives that came out of that for cancer care. One of those is that we do more telemedicine now, and that wasn't something we routinely did. But now that gives patients, women, especially younger women that have families and jobs, a little bit more flexibility to get care in a way that is more convenient for them. The other way that changed is it also allowed us to see that we can maybe change up the order in which we do some treatments depending upon the cancer type. So if somebody has a really important event coming up, a big family trip that's a once in a lifetime thing, maybe we start something like hormone blockers first to allow them to get to that trip, feel really good, and still be on active treatment.
I want to circle back to what you said about telemedicine. What does that really look like when it comes to preventing, diagnosing, treating something like breast cancer?
It can be a whole lot of different things. And so we don't typically use that for a first evaluation. Really having that in-person evaluation is really important. However, on the follow-ups, if somebody is having a particular side effect, that's a really great way in order to have that conversation that doesn't necessarily require an exam. And you can do that from your office or from your home and not have to add that extra time to come in and see somebody. So it really allows for better access for patients to get the care they need.
Well, Dr. Chrystal Murray, that's about all the time we have for this afternoon, but what a great way to kind of kick off Awareness Month about this and share some advice for people out there. You're the experts, so we appreciate you coming in and joining us to talk more about that.